Hello. Before I begin, I would just like to take this chance to say thank you to everyone appropriate and still here for allowing me to speak to you today. Shouldn't take up too much of your time. My name is Sal Sodaro. I'm a student at the University of Connecticut over in Storrs, where I've been studying history for the past 3 years. I've lived in Connecticut my entire life, New Haven for, ever, up until now when I live in Willimantic, which is where I live, where I attend UConn. I have gone to schools public, private, and home-based. When I was 12 years old, I was diagnosed with Crohn's disease, an inflammatory condition of the digestive system. Associated with my Crohn's disease is also a diagnosis of arthritis in most of the joints of my body. Both of these conditions are chronic and have no cure, only treatments to lessen the symptoms and the pain. Over the past decades, my prescribed treatments have varied greatly in form. There have been times when my treatment consisted of taking dozens upon dozens of pills a day. No fun. There have been times when I must get regular day-long protein infusions via IV, which leave me feeling woozy and weak for days afterwards, as well as increasing my chance for malignant cancer. I've had some doctors even, on occasion, prescribe me opiates for my pain. Opiates. As I'm sure you know, these are incredibly dangerous and addictive drugs. We've heard, obviously, earlier tonight. While not being entirely useless by any sensible use of the word, these costly and cumbersome treatments have not provided me with an absence of symptoms nor an absence of pain. The active agents in marijuana, you've heard of some tonight, THC and CBD, have been shown to have anti-inflammation properties. Marijuana has been shown in studies to reduce debilitating symptoms of diseases such as Crohn's disease, IBS, and ulcerative colitis, and even reduce the amounts of medication required by patients. What I can tell you from my personal experience is this. Sure enough, using marijuana relieves pain and discomfort throughout my body in both my joints and digestive tract. I often get stress headaches related to my Crohn's disease. Pain begets pain. These two all but disappear while using marijuana. When I use marijuana, my appetite increases. To me, this is more than a silly stereotype. This is a matter of staying healthy. I struggle to maintain a healthy weight or a regular appetite, and using marijuana has allowed me to enjoy a regular enough diet to maintain a healthy weight. Truly, I owe much to this plant, this medicine, yet I must use it in secrecy in fear of criminal prosecution. The question has been raised in debating this bill to legalize medicinal marijuana. What message does passing this bill send to the citizens of Connecticut? What message does this send to people? Well, I can tell you that the message that I and many other citizens in a position similar to my own, the message that we receive is that we would now be able to be prescribed and legally use a safe and effective medication to treat our chronic illness. The message my parents would receive, I've asked them the question, is that they would no longer have to worry about their son being in chronic, constant pain, nor about the state tracking him down, only one more paragraph after this, or the state tracking me down for trying to alleviate myself of that pain. The message a cancer patient may hear is that following their next dose of chemotherapy, they may have an alternative to the nausea that they have become so used to, and they may be able to eat normally once again. Regrettably, it is impossible to know what everyone thinks about everything. This is why representatives such as yourselves have been elected to make decisions on issues such as these based on a perceived mandate or desire from constituents. Now, I understand that such a mandate, interpreting or finding one, can be a tricky, time-consuming, and divisive task, except in this instance. Because in March of last year, Quinnipiac University polled Connecticut voters on this very issue. The poll found that 79% of those polled were in favor of legalizing medicinal marijuana in Connecticut. That's nearly 4 out of every 5 people you walk by on the street in support of this legislation. That's a clear mandate as I've ever seen. In the very same poll, only 65%, still a majority, but still far fewer, only 65% of people supported the decriminalization of marijuana in that same poll. That's 14 percentage points less than medicinal marijuana. And remember, the bill to decriminalize possession of small amounts of marijuana, I believe it's Public Act 1171, that passed in the Senate and the House. That's more evidence that the path to this bill's passage is one to be followed at all costs. I, for one, am very happy to live in a state whose residents and representatives are responsible enough to discuss this issue openly and maturely, free from scare tactics and in respect to fact, because this is bigger. This is bigger than the law. This is bigger than any one individual here today. This is about allowing real individuals with real health problems to treat themselves with a real plant, a real medicine that really works. And I can tell you that for a fact. It does work. Thank you for your hearing.
Thank you. Good job. Questions? Senator Kissel.
I want to thank you for being so patient to wait. Jeepers.
It's a virtue.
8 hours, 45 minutes, 9 hours?
Midterm in the morning. It's cool.
9 hours and 45 minutes. The level of testimony today has been incredible.
I agree.
I've been lucky enough to be a state senator for 20 years, and this bill proposal has been around for at least 10, if not more. And first of all, the room used to be packed, and I hate to say it, I don't want to mischaracterize anybody, but it just people that seemed really sort of out in left field, and I'm just trying to be as nice as I can, but they didn't. The advocates didn't necessarily come from folks that were suffering from disease. I think they had, in some instances, not all,
at least not visibly,
a different agenda. Now, maybe it's because the decriminalization of marijuana bill went through last year. I didn't support that. God bless you. I do have concerns as to the message it sends to young people. Mm-hmm. But when it comes to this, perhaps it's because the passage of time. Quite often it takes a number of years for things to get through this building. Maybe it's because some of the concerns that myself and others have raised have been built into this bill as far as dispensing it and using pharmacists and having a chain of control over the product. Or maybe our society has just changed. Good. But you're a young guy. First of all, I feel very bad for you from the bottom of my heart, given your illnesses. But boy, you're articulate. You've got great promise. If this can help you get through the rest of your life and reach all your dreams, who am I to say no? And we have protections in here. I don't want you to be an outlaw. I don't want you to be a criminal. And if this alleviates your pain so that you can go on and do all the other things in your life, then I'm completely in support of that. And I really appreciate you taking the time to come forward and share your story with us.
Thank you very much. I would also just like to say, in terms of you mentioned protection, I would like to see possibly some language in the bill that protects students living on campus at public universities such as UConn from being persecuted or prosecuted in any other way, say by the institution itself, for using their medicine, which they are legally prescribed. I know that the University of Connecticut has additional punishments for the possession of cannabis on their campus that they impose additionally that are more than on the law in Connecticut. And I would like to make sure that, you know, in terms of decriminalization of marijuana, that's not what we're talking about today, but if a student is living on campus in a dorm and they are legally prescribed this medicine, they should be allowed to have it and use it where it is sensible.
Well, if I may, Mr. Chairman, I would think that since we have control, titular control at least, over what takes place at the University of Connecticut, its branch campuses, the state university system, and our community colleges, I would hope that they would be in compliance with the protections afforded in this law, and if we have to spell it out, we will spell it out. I understand why they're coming at it from a zero tolerance point of view, but if this is something health related, then just like if you had any other kind of controlled pharmaceutical in your dormitory or where you were living that you could only get with a prescription, I think that, you know, you can't bust someone for that. Right. So this should be treated similarly. And I also would hope that for those individuals, if they happen to be in college at our private colleges throughout the state of Connecticut, that those places would be sensitive too. My guess is that that shouldn't be a problem.
I would hope not. Thank you.
Other questions or comments? If not, thank you very much.
Thank you very much. Have a good one.